Hi, my name is Kayla, and I am a student in the BSN program at Florida State College at Jacksonville. I am also a registered nurse on a neuroscience unit at a local hospital. The point of this video is to share my knowledge on stroke and stroke education for our patients, and hopefully at the end remind my fellow nurses that this is education that we need to be providing to all of our patients, regardless if they are a stroke patient or not. So we're just going to start with some basic stroke facts. 1. Every year, more than 795,000 people in the United States have a stroke. 610,000 of those, it's a first-time stroke. The remaining 185,000 is a repeat occurrence. 2. Strokes kill almost 130,000 Americans every year. 3. About 87% of strokes are ischemic strokes. The remaining 13% are hemorrhagic strokes. 4. Strokes are more likely to occur in males, however, females are more likely to die from them. And 5. Risk of stroke is highest in African Americans. So next we're just going to briefly cover the different types of strokes. First up is the ischemic stroke, the more common one, remember 87%. So an ischemic stroke is when a clot, usually a fatty plaque deposit, is traveling in a blood vessel leading to or inside the brain and ends up clogging that blood vessel. When that happens, the brain can't get the blood and oxygen that it needs, so then those brain cells start to die. The other main type is a hemorrhagic stroke. A hemorrhagic stroke is when a blood vessel is weakened and it ends up rupturing. So then that blood leaks out into the surrounding brain tissue, and once again, the brain cells start to die. Another important part that we need to discuss is TIAs. I'm amazed at how many people do not know about this. TIAs are transient ischemic attacks. They are transient, but they are ischemic. So basically what happens is that clot doesn't stay there. It ends up breaking free and it keeps on going. So the symptoms that the person feels, they end up going away. So this is the biggest reason why it is important to discuss with your patients. People think, okay, the symptoms went away, I'm okay, I don't need to worry about it, it's fine. It's wrong. Usually they are a precursor to a stroke in the future, so they need to seek medical attention immediately. So next up, we're just going to cover the symptoms of a stroke. I'm sure you've all heard of the acronym FAST. We're just going to go over it very briefly. I figure it's the best way to remind people what the symptoms of a stroke are. So FAST. F stands for face. You want to look at their face, see if one side is drooping. A is for arm. Ask the patient to raise both arms up into the air. See if they can raise both arms, or if one arm's weaker, or if one arm just starts to drift off to the side or down. And S stands for speech. Ask the person to talk. Is it slurred? Are they not able to talk, etc.? And T is for time. Time to get that person to the hospital. So next we're going to discuss what to expect if you get a stroke alert. So once a person arrives into an emergency department, they're going to get a CT scan. They need to be seen by a neurological doctor who's going to determine whether or not they are a candidate for TPA. Once they arrive on the unit, whether it's a confirmed stroke or not, there are certain orders that you can expect. So first, you're probably going to expect an MRI. So be ready to do an MRI screening. Also, because of the MRI, you need to make sure that your patient has an IV in their arm above their wrist for the contrast. You can also expect some lab orders, definitely a lipid panel, but probably a full-on everything, CBC, BMP, MAG, FOS, everything. So you're also probably going to be doing neurochecks every 4 hours, and we'll go over that very soon. And the other one that you're probably going to expect, depending on the patient's condition, you might have to do a bedside swallow screen just to see if that person can swallow safely. So let's just get back into that neurochecks. So at the hospital I work at, we use the MIND exam. The MIND exam is very comprehensive. It does take a little bit longer than some of the others, but you can catch a lot more. There's 12 steps to it. The first one is level of consciousness. You want to see how awake they are, how responsive they are. Do you have to, give them a little shake to wake them up? Or are they just opening their eyes to voice, etc.? The next one is speech. If they're awake, you want to ask them to repeat a simple sentence back to you, such as, "You can't teach an old dog new tricks." See if they can remember the words, see if they're mixing them up, or if they just can't even get that sentence out. Third, you want to ask them a question. Keep it simple. I usually go with, "What is your name?" Just see if they respond appropriately. 4, you want to see if they respond to a command. Once again, keep it simple. Ask them to open and close their eyes. Whether or not they're actually able to open and close your eyes, it's irrelevant. You're not looking to see the motor function here. You just want to see if they understand what you're asking of them and try to do it. Next one is the facial droop. You just want to see if one side of the face is drooping, so ask them to smile. The next one is the visual fields. We all learned this in nursing school. Gonna put your finger in front of their nose, about 18 inches, and you're gonna put it up to about forehead level and wiggle your fingers. Then you're gonna go down to chin level, wiggle your fingers again. You want to see if they can see it. They want to keep their eyes on you. You just want to see if they can see your fingers wiggle at all. The next one is also about gaze. Once again, finger in between you and the patient, and you're going to go from right to left. Once again, they need to keep their eyes on you. You just want to see if they can see your finger, and also if both of their eyes are tracking at the same time. So the next one is the motor arm drift. You're going to ask them to put their arms straight out in front of them and see if one arm starts going down or going out. Next one is the motor leg drift. Ask them to lift one leg in the air at a time and will see you later.